Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. Minutes past 8 o'clock. It's Monday morning, the 11th day of August, 2025. Good morning, everyone. I'm Scott Michlin. Thanks for tuning in to KSJE, 90.9 FM over the airwaves here in San Juan County, New Mexico. In Durango, Colorado, we're broadcasting at 103.3 FM. And if you're listening to my voice anywhere else on the planet, maybe you're listening through the new KSJE app, or you've gone to our website to tune in, ksje.com. I also want to welcome our viewers who are joining us this morning. You are watching the video version of this program. It's streaming out live to the KSJE Facebook page and also to our YouTube channel. Welcome aboard, everyone. So glad that you're with us this morning because our topic today is all about children's health. My guest from Presbyterian Medical Services. Stay tuned for that coming up in the next few moments right here on KSJE. Then a little bit later this hour, we'll be checking in with Lewis Campbell for our Monday Reboot segment. That's when I get to talk about technology. That you will see and hear today at 8:50 a.m. on KSJE. Next hour, of course, we turn to classical music, roving with the arts. Mick Hess will be here with our weekday classical music program at 9:06 on KSJE. Don't forget, you can connect with us on other forms of social media like Instagram and Blue Sky and X, in addition to Facebook and YouTube. And if you're a podcast listener, you can find KSJE podcasts available wherever you listen to podcasts. You can subscribe for free and maybe discover a new local program that you may have missed recently. Also, don't forget about the new KSJE app. It's available now at the App Store and Google Play. You can stay connected on the go. Streaming, podcasts, much more, all part of the KSJE app. Outside our studios here at San Juan College, it is currently a sunny Monday morning, 62 degrees at the moment. We're expecting a mostly sunny day today with a high of 89 in Farmington, 63 overnight. More sunshine tomorrow with a high near 90. It'll be partly sunny Wednesday with a high of 92 and 92 again on Thursday, and maybe a chance of a shower developing on Friday with a high of 87. I'll be back with my guest from Presbyterian Medical Services right after this on KSJE. KSJE is supported by San Juan Regional Medical Center. The most important ingredients to sustaining health and wellness are the resources and tools that help you live a vibrant and healthy life. At San Juan Regional Medical Center, the goal is to promote health by making sure those resources are available. Find the path to the best life at lifebetterhere.com. San Juan Regional Medical Center. Better is our mission, improving lives through personalized health and care. I'm back in Studio A with my guest this morning, as I mentioned, from Presbyterian Medical Services. Dr. Paige Pomo is here this morning, pediatrician with PMS here in Farmington. Good morning. Welcome back to KSJE.
Thank you, Scott. Good
to have you here. Also joining us here in the studio, Carrie Olson is here as well. She is public relations for PMS here in the Northwest region. Community relations, I should say. Carrie, good morning to you.
Good morning.
Always great to have you here as well, so thank you for being here. Dr. Pomo, let's start with you a little bit about, here we are, end of summer. School has started, and it's all about kind of back to school for children's health. You were a pediatrician, I should say, too, right, at PMS and the Farmington Community Health Center. Also, for our audiences, full disclosure, I remain on the board of directors for PMS as well, so it's great to have you here, as I said. But back to school, vaccinations, an important time for parents to make sure kids have what they need to get back to school.
Absolutely, yes. Yeah. We just finished a couple sessions over the summer for back-to-school vaccinations called our Got Shots program through the Department of Health. We gave out over 60 vaccines over the last couple weeks, and it's still not too late to get your kid up to date on their vaccines. So if you're getting those letters from the school nurse, we're here to help you. As part of the Vaccines for Children program, all of our vaccines are free, whether you have insurance or not. So that's never a barrier.
Gotcha. That's important. And so,
absolutely.
And of course, I know PMS accepts all forms of insurance, right? So that's never an issue either.
Yeah, including no insurance. So,
yeah. Yes. So that's good. And so it's important for folks to stay up to date, for parents to stay up to date with vaccines for their kids, obviously, right?
Yeah, as a lot of people have probably heard, there are measles outbreaks in our community. Thankfully, we've only had one case here in San Juan County, but across the country, vaccine preventable disease is only a car trip or a plane ride away. And so vaccines are a really effective way to protect our children from these life-threatening illnesses. And so, for example, a lot of parents are coming in asking, is my kid up to date on measles? So typically kids get their first measles vaccine at 12 months of age and then their booster at 4 years of age. So never too late to check in. We're always happy to make sure their kids are up to date and print out vaccine records if needed and help coordinate between school nurses and our clinic to make sure kids are up to date and that they're not missing school because of that.
Right, so. Definitely. Thank you. And measles is certainly the one we've been hearing about in the news,
yes.
But there are other important vaccines too for kids, right? And especially at this time because they're still building kind of their immune systems, right?
Yeah, absolutely. There's definitely pertussis outbreaks, so our tetanus boosters also include a pertussis booster. Whooping cough is the common name for that. And so, kids get that up until 4 years of age, and then there's a big gap until 11 when our middle schoolers start to get their booster as well. And then even as adults, we're supposed to get a Tdap or tetanus pertussis booster every 10 years actually. So don't forget to check with your doctor too as parents. We need to get our boosters as well.
It seems like we hear about those outbreaks maybe more in the wintertime and things like that. Is that kind of when they start showing up, those respiratory types of ailments?
Certainly they can. RSV being another really more famous virus. And we're really fortunate to have some RSV vaccines for our infants under a year who are more vulnerable to that. So yeah, definitely stay tuned. We don't start giving RSV vaccines for the babies until around October.
Gotcha. Very good. And I always like to ask a medical professional when they're here with me to talk a bit about just the importance of vaccines as far as society goes and things like that. We hear about these terms like herd immunity and things along that line. And so I think, that's kind of why measles was eradicated much in this country back in 2020? Not too long ago, but it was completely gone for a while, or at least low enough that no one really was concerned. But now, as you said, we've had these outbreaks in nearby Texas and in one case here in San Juan County. And so that does affect the rest of us, I guess, society.
It does, yeah. Unfortunately, we're really privileged in the United States that we do oftentimes have enough herd immunity that we don't see a lot of these vaccine-preventable diseases because we've eradicated them, right? Or at least they're low enough levels.
They're so low, yeah.
Yeah, and so, but what happens is when we kind of become overly confident in that sense and forget that the reason why we have that protection is because we're all getting our vaccines to protect those that maybe can't be immunized for various reasons. But yeah, if you're able to get a vaccine to protect you from the disease, that is the safest and best way for your child to be protected.
Sure. And if parents have a concern about that, is that something they can talk to with their doctor, with you?
Absolutely.
I mean, if someone comes to you and says, I don't know if my child needs to have a vaccine, or, I know each case is different, and it's important, I think, for parents to maybe take those concerns to their doctor.
Absolutely. We are here to be a science-based and just the right source for parents to get evidence-based information, because it can be very confusing on the internet, like what's true and what's not, and there's a lot of disinformation.
Wait, you're telling me the internet is confusing? Are you?
There's lots
I think
of good,
you're right about that, doctor.
There's lots of good sources out there, but you have to be savvy to know what's science-based and what's someone's opinion, right? And those are very different things. And so we're here to help families and parents navigate that confusing landscape, because we want them to feel confident that vaccines are safe for their children and safe for our community.
Right, and you're never annoyed when parents ask about vaccines or other medications or things like that for their kids, are you?
I'm there to be their partner, to help them feel confident taking care of their child.
Very good. Well, that's good to know, and thank you for mentioning that this morning. The other thing I wanted to ask you about, too, are sports physicals. That seems to be another kind of rite of passage with the start of school, right, to make sure kids are ready to go and are ready to get on those sports teams and things like that. You offer those, too?
Yes, we do offer them. I think they're $25, so very affordable. It is time for sports physicals, so it's helpful if families bring in their forms from their respective school, but if they don't have one, we have extra copies in the clinic for them to fill out. So yeah, definitely a really important time, not just to make sure their child's ready for sports, but also just can be a chance for us to also check their vaccine records, as we were talking about, and make sure those 16-year-olds don't need a meningitis booster, for example. Also helpful, like getting them back into clinic to make sure there's not other routine health things we need to address, maybe like their asthma, for example. It's also back to school time for asthma action plans to make sure they have access to their medications and a chance to do some education for those athletes that have exercise-induced asthma.
Right, very true. And it seems like we're hearing more about some of the asthma cases than we used to. Is that just me hearing that more, or what do you think of that? Is that, or am I off base?
Well, I think this time of year, especially with how bad the wildfires have been,
True.
the
The air
wildfire
quality's been
smoke
bad.
can certainly be a trigger for a lot of children and teens with asthma.
Good point.
In addition to just kids being more active, if they have an exercise component of their asthma, this can be a time where we see those triggers. So just providing that education of like, hey, these are the signs to watch out for, this is what you need to do to treat or prevent those symptoms, can be really empowering for those patients and families.
Got you. And for children, teenagers, I mean, if maybe asthma wasn't bad last summer, but maybe this summer it's worse or it's better. I mean, does that happen from year to year in young people?
Yeah, it can. I think it also just comes down to us sleuthing to figure out what are the maybe new triggers in their environment. Is it because now they have a cat that's sleeping with them and they have pet dander that's triggering their asthma, versus are there other environmental allergens and or just like smoke triggers, right? I have a lot of families that maybe don't recognize like vaping can be a trigger for their child's asthma because there's the same kind of risk of secondhand vape just like secondhand smoke. So providing those educational opportunities to say, hey, maybe there's some ways we can help mitigate these triggers for your asthma so it's not affecting your ability to do the things you love.
Right, very true. And with the sports physicals, again, you are looking at making sure the child is, the teen, young person is healthy to do the sport that they are wanting to sign up for and things along that line. I guess we always hear sometimes about some maybe underlying health conditions that could come up during a practice or particularly strenuous workout or what have you. Is that some of the things you're able to look for as well in many cases?
Absolutely. It's very like cardiovascular focus, so making sure the heart is healthy, the lungs are healthy, and also the muscles and joints, making sure that there aren't risk factors for injury, and also, looking at it from a preventative standpoint, right? How can we keep these kids from getting heat-related illnesses, right? Knowing that the temperatures continue to rise in our region and making sure that they know how to stay properly hydrated for some of these intense activities they're doing outside is also an equally important part of the physical.
Sure. I know with temperatures in the 90s or what have you, I can barely walk to my car without feeling a little winded. I can't imagine doing through a whole football practice or something like that. So that's an important thing for folks to be aware of. But I'm not 15 either, so that's probably the other part of that equation. So that's important to know. For folks that want to maybe sign up for these, do you have walk-ins available? Do they need to call and make an appointment? What would you suggest for folks for any of these things? Vaccinations or back-to-school sports physical, what would you say?
Yeah, making an appointment is always helpful because then you're guaranteed a slot, but we do offer walk-ins on a weekly basis. So.
Right, at the health center there.
Correct.
Right,
Yep.
which for folks who aren't aware, that is over on the west side of town. The address is off of Broadway, but it's easier to probably get there from Murray. But you can still get there from either direction. So I would say it's, and then for folks who've been around a long time, it's where the old American Plaza used to be, is how I remember it. So that's how you can find it, the Farmington Community Health Center. There's another program that you've been involved with too, which is a reading program for kids in the area. And so talk to me about this Reach Out and Read program.
Yeah, so we just completed our 4th year of Reach Out and Read. We've given out over 1,500 books the last 4 years. This program specifically is a national program that helps encourage parent-child bonding through reading and early childhood literacy. So really helping our kids' brain development so that they can one day talk and share all their thoughts with us through reading. It's a really powerful program. So kids from birth to 5 years of age get a developmentally appropriate book to share with their family at each of their well child checks. So by the time they head off to kindergarten, they have anywhere from 12 to 15 books for their own kind of library.
Oh, cool.
Yeah.
How great. And it's important, I think, even if kids are not old enough to read, but to be read to, that is still an important part of that, as you said, and that interaction, that bonding with parents or any adult, I guess, really, right? To be able to understand and maybe follow along and see what some of those words look like even before they understand how they are pronounced or what they are.
Absolutely, yeah. Even some of the parents, when the newborns come in for their first well check, are like, really? My kid likes to hear my voice? Like, yeah, they love to hear you read to them, to talk to them. Some of our books are like sing-along. Some of them are mostly just pictures, like high contrast or touch and feel. So they're, it's all that sensory integration that is just, their brain is a sponge just absorbing so many different inputs. So it's a really powerful way to build that bonding and that resilience, right, as they move forward through the good times and the hard times of parenthood and childhood. So.
Sure, right. And as much as it pains me to say it, not leaving them in front of a radio or a TV to listen or watch or screen, but having that more one-on-one interaction is really important too during development stages,
yes,
right?
Yes, absolutely. We really don't recommend any screen time under 18 months, and even in those early years, it's really important that it's shared co-viewing, like FaceTime if you're, interacting with other family members. But yeah, really kids under 2 shouldn't be having any screen time. They should be, playing with toys, reading with their family, interacting with human beings. So
yeah. And so those books give mom and dad a reason to kind of stop what they're doing and really spend that time with that young one whose brains are like sponges. I think you're absolutely right, especially during those ages, right? They're just absorbing everything.
Absolutely.
So that's an important thing. Well, that's a great program, and that will continue, I guess, too?
Yep. There's no signs that we're stopping, so.
Okay. Very good. More books to hand out, so.
Yes, and I do want to mention we have books that are in English, and then English-Spanish bilingual, and then English-Navajo bilingual as well. So that's been a thing we've been able to actually incorporate over the last couple of years, too.
How terrific. Yeah. That's great. Well, again, more reasons that's such a great program, an important program. So thank you for sharing that, and congrats to PMS. That makes me proud as a board member that we are doing that in the community, so that's wonderful. Not too early to start talking about cold and flu season. What do we think coming up? Do we know what the flu is going to be like this year yet?
I don't think we know quite yet. We certainly look at kind of the southern hemisphere to see how their flu season is as we gear up for ours, but we should have our flu vaccines by late September, early October, again through the Vaccines for Children program, so those are free. We usually offer some walk-in options too for families that want to just come back, get vaccinated both as parents and with their children.
Right.
But yeah, never too late to get your flu vaccine, but we don't have them yet, so don't rush in quite yet.
Yeah.
We don't get them until late September, but yeah, certainly our kids that are in daycare and school, they're certainly vulnerable for influenza, so they can start to get their first flu vaccine as early as 6 months of age,
right,
all the way up through late adulthood. So
exactly. But this year we're not expecting anything more serious than usual. At least I haven't heard of anything yet. It probably another typical type of flu strain that we're seeing in the southern hemisphere where it's winter now.
Hopefully, yes, but hard to say until we're in the thick of it, yeah.
Okay.
So prevention's the most important thing, getting your flu vaccine early and every year.
Very true, very true. And I think when you talk to folks, anyone who's had the flu will tell you that it's not fun. It's not a fun time.
No, it's not.
And so they'd rather have the vaccine, I think, to try to at least get as sick as they do without the vaccine.
Yeah, so I think one thing I just remind families is this is a killed version of the virus. You can't get sick from the vaccine.
True.
It can be, your kid was starting to get sick with something else around the time they got the flu vaccine and just sort of ended up with a cold virus. But I wish I could say we're bulletproof with the flu vaccine, but we're not, right? You could still get sick with flu, but the goal is that you're not so sick that you miss a bunch of work or school and not sick enough to end up in the hospital with pneumonia or needing oxygen. So it's a really effective vaccine from that standpoint. Good
point. Very good point. Another topic I want to ask you about, too, is an early childhood development grant that PMS has received from the state. And so talk to me a little bit about what that means.
Yeah, we've been... This grant we've had about almost 2 years ago now, so really focusing on early childhood development from birth to 5 years of age and making sure that all of those kids at their routine well checks are getting developmentally appropriate screenings, looking at their social emotional health, their physical, language development. And so it's a chance also for us to look at social determinants of health too and make sure we're addressing any food insecurity, housing insecurity. We're really fortunate at Presbyterian Medical Services. We have the Community Compass too, where we can help connect families that maybe do have food or housing insecurity with one of those community navigators to help plug them into those resources. And then, of course, from the medical side, helping plug in those families if a child does have an identified developmental delay, getting them into early intervention services. For example, through our Roundtree program, from birth to 3 years of age, they can get paired with a developmental specialist, a physical therapist, occupational therapist, or speech and language pathologist to help support the family and the child in reaching those developmental milestones. And then we also coordinate with other community entities as well through Farmington Preschool Academy if a child is between 3 and 5 years of age and has identified developmental disabilities that needs to be seen for those services. So,
right. Yeah. That's a lot. And again, it is literally a wraparound type of service that is provided, right, for families that I guess you're right. Sometimes someone will come in and they just came in for maybe a vaccine or a back to school check or a school physical or whatever, and then you find out, but wait, there's something else going on here, and maybe there's some food insecurity, or maybe they're not sure where they're going to be living next week because there's issues with the landlord or rent or whatever. And so you've got resources literally in some cases right next door to be able to send these families to, and to be able to help them figure this out without having to go to a bunch of different places around town.
Exactly. Yeah, it's what we call like a medical home.
Yeah.
So, yeah, we can really connect them with those resources, including behavioral health resources too, which is part of Presbyterian Medical Services. So it's nice to have those kind of under one roof to provide that warm handoff to families.
Right. Very true. And we don't want to get mad with the dentist, so we have to talk about this dental care too, right?
We do have dentists. Yes.
So don't get them mad at us. That's
Fair
true.
enough.
So, but that's important. So very good. But there's a lot of things that are going on. You have been here for how long now at the clinic?
It'll be 6 years at the end of August.
Good for you,
Yeah.
right? And the work has got to be important to you, obviously, and meaningful to you, and seeing these kids that come in from the community and getting them on their healthy lifestyles.
Absolutely. I love getting to build connection with the families. It's been neat getting to see some of my newborns head off to kindergarten now that I've been here a full 6 years, or seeing some of those middle schoolers graduate high school and head off to college. So it's been really just inspiring and humbling to get to partner with these families and help their children thrive, and just, work with them through the ups and downs of life, and recognizing that, they each have just amazing potential. And just, I think as a pediatrician, we have a unique opportunity to also just support the parents too. It's really hard being a parent, and I think my goal is to help support them, that they feel like they're doing the best for their child, and encouraging them that this is a challenging season, but their child is going to grow and thrive, and providing them those supports where they need them.
That's great. Very good. Well, it's always great to have you here. You've been here a couple of times now, so thank you for coming back.
You, Scott.
And the work that you do in the community. I want to let Carrie have a few words here as well, because she's been waiting patiently to get a word in edgewise here as you and I have been talking, and that's okay, because Carrie Olson is involved in a lot of these different things too, a lot of these things that we've been talking about, like the books program and the other thing that we were talking about too. So lots going on. And Carrie, you've got some other things happening too, like September is a big event, right?
Yes.
For
So
PMS. Go ahead.
I do want to say that I've worked with Dr. Pomo for the last 6 years, and we are so blessed to have her. She's wonderful at what she does, and really the Reach Out and Read program was completely hers, and her and I have been working together for 4 years now to get those books out. We're very proud of it, and yes, it will continue.
Congratulations.
We just bought tons of books for the next 2 years, so
Nice.
it'll at least be for the next 2 years, but hopefully that'll just be something that continues on forever. But we are incredibly blessed. So I also want to mention that she speaks fluent Spanish, so if you have some language barriers, she can help you out there.
Very good. That's important too. So
Yes,
terrific.
but I'm all things.
Other things too.
Other things as
yes,
well.
Exactly.
Speaking of the ECD grant, which is the Early Childhood Education Grant, we just had a Community Compass event 2 weeks ago. We gave out baby bags. We had 150 bags that was just jam-packed with good stuff for parents, brand new parents. It was a backpack that opens up into a portable bassinet, and then just great stuff like milestone information. If you miss that, you are more than welcome to call me, and we still have some extras, so we would be happy to give those out to you. You can call me at 505-427-9399. Again, my name is Carrie.
Okay.
And we have some of those bags, and we will be doing that for the next year. So
Nice.
We're very, very thrilled with that.
Yeah.
It's the parents have been very responsive. They love it.
I bet. And it's just not just bags. You fill those bags with stuff.
We fill
which
them.
is really helpful, right? Yeah.
Diapers, wipes, pacifiers, books,
Nice.
hooded towels, shampoo. I mean, just packed.
Yeah.
It was really fun to give them out. And
Nice.
we started at 9 o'clock, and by 8 o'clock that morning, we had a huge traffic jam out on Murray because so many people waited to come and get those, and we just, it was really wonderful.
Nice. Very
wonderful.
good. Well, congratulations. That's nice to hear. And obviously a need in the community. So, and so many folks showed up, which is great to see as well. You have an event coming up in September that I wanted to ask you quickly about, right?
Sure,
That is the Drums of Summer event, right?
Drums of Fall now.
Drums of Fall, pardon me, because it's in September.
But it used to be Drums of Summer, so
Okay.
you were on the right track.
Okay.
It's Drums of Fall because
Thank
it
you.
is in September. They are are celebrating their 20th year, which is
Wow.
absolutely fantastic. It'll be at McGee Park again. Last year we had over 100 competitive dancers. It's free to the public, so just come in.
Right.
And we had 45 vendors and about 800 spectators. It is a fundraiser. It's the only fundraiser that TOTA has. So we just invite everybody. It's from 11 to 8 o'clock. Yes, you heard that right. 8 o'clock.
Right.
If you've ever been to a powwow, they go a little long sometimes.
Right.
But it's quite beautiful to watch.
Yeah, very true. Well, that's exciting. And so
Yes.
that's coming up. The Drums of Fall
Drums of Fall.
event again. And the date again is September
13th.
13th.
It's a Saturday at McGee Park from 11 to 8.
Okay, very, very good. And then I know you don't want to think about it, but
I think about it all the
have
time,
to
Scott.
ask you about Festival of Trees.
Yes.
Another major fundraiser for PMS and all the programs that we talk about,
Correct.
right?
Again, other than TOTA Drums of Fall, it is our only fundraiser for
Yes.
PMS. This year it starts Tuesday, December 2nd. That's when it'll be open to the public at 5:30. And then we give away the trees Sunday. I shouldn't say we. Scott gives away the trees.
Well, we broadcast the
We
drawing
broadcast
of the
it
trees.
live,
Yes.
and we appreciate you doing that
Yeah,
every
sure.
year.
It's great.
December 7th.
Okay.
So that's a Sunday. And then all the wonderful things in between. We are right now looking for sponsors. So if you are interested in sponsoring one of our events, we have
Right.
9 of them that happen throughout the 5 days. You can go to pmsfestivaloftrees.org.
Okay. There you go. Or if you're thinking about putting a tree together or a
yes,
wreath
please.
or anything like that, there's also,
Yes.
this is the time to start thinking about that, I guess, too, right?
This is the
So-
time, absolutely. And you don't have to do a tree, although we will love them. Last year, I think we had over 75 trees.
Yeah.
But you could do a wreath or a centerpiece or anything that just speaks to you.
That's right.
Christmas, all things Christmas.
All things Christmas.
Yes,
That's
and
true.
all the money stays local here with PMS.
Okay, that's true. Very true, and supports all these programs that
Correct, all of our
we talk about here on the station. So that's great. And just one more time, since you want to give out your phone number, would you give out your phone number one more time if folks do want to call and get
baby
one of
bag.
those leftover bags?
Absolutely.
Yeah, please.
505-427-9399.
Okay.
Or they can call the clinic as well, and they will get in touch with me, and that's 327-4796.
Okay. And they can make an appointment through that number too,
Exactly.
right? So, I heard the doctor on the radio this morning, so I'm calling to make my appointment. That's
Absolutely.
what you can do. So that's perfect. Very good. Well, I thank both of you for coming in this morning. Dr. Pomo, always great to visit with you. Carrie, always wonderful to have you here. Thank you for coming in bright and early on a Monday morning, and for all the work that you all do in the community with PMS. I'm proud to be a member of the board when we talk about great things like this. So thank you both very much.
Thank you.
Have a good day, everybody.
You too. Thank you.
Thanks.
My guest this morning from Presbyterian Medical Services here with me on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.